my friend, he has asked me why you are showing this roadmap. What is the importance of this roadmap? To dear doctors and for every public, this slide I believe this is the core of HOMA insurance, insulin resistance. That is, we are waiting for the diabetes to happen. So he was asking whether first triglycerides will come or diabetes will come. So diabetic dyslipidemia is getting confused with dyslipidemia causing diabetes. This is the image of all the people who are, there are some doctors who are, or some scientists who are looking only after cholesterol. There are some people who are looking only after blood sugar. Like that, various parameters we are going in different directions, but we are not focusing on one side. This is called elephant in the metabolic room. So homeostasis model of insulin resistance, HOMA, is fasting insulin into fasting blood sugar divided by 405. So the two parameters are important. We are focusing only on blood sugar. This roadmap I am showing is before we become diabetic, till 85% of pancreas is destroyed, our HbA1c and blood sugars are normal. So whenever you want to modify the treatment, everything based on you are doing a wrong goals like HbA1c and blood sugars. They are mountains. They won't move early. Earlier markers are there by which you can define, and goals will be changing if you start using fasting insulin. So 10 years ahead, the fasting insulin levels will go up, called hyperinsulinemia, because of insulin resistance. In this slide I have shown very good, one very young boy, 22 years old. He is not a diabetic. Can you see the fasting blood sugar is only 86. His cholesterol is normal, but his insulin level, fasting insulin, is more than 33, and post lunch is 102, and his weight is 120 kgs. His waist circumference more than 100 centimeters, more than 44 inches. This is a group of people called as insulin resistance, homeostasis model of insulin resistance, wherein later on they develop, after the beta cell exhaustion, they develop diabetes. This roadmap is what I wanted to tell everybody. This is a heart and core of homeostasis model of insulin resistance. You can see here HDL comes down 10-20 years before we become diabetic, before we get a heart attack. Later on the triglycerides will increase. Why they are increasing? Whenever you eat any food, any carbohydrate that you are going inside, majority of the rice that we are taking or wheat that we are eating they are coming out without a fiber, and blood sugars are going up. These sugars are getting converted into fat and stored around the abdomen. That is the reason why the blood sugar will always appear normal. So this is the core concept. If you can do a fasting insulin into fasting blood sugar divided by 405, if it is more than 2 and the waist circumference is increasing more than 85, now with the 4th or 5th generation Indians who are parents or grandparents are either cancer or heart attack or diabetes or hypertension. If any family history of all these are there, this is the group where you have to focus, and don't wait till the beta cells are getting exhausted. This is very, my close friend, he has asked me about this roadmap. So this is I want to show to him, and also to all the doctors, that there is a time frame. 10-15 years ahead we can tell who will get diabetes, and out of diabetic patients, instead of pushing them into insulin, can we check insulin resistance is there? And by doing a fasting insulin, we can prevent patients to push into insulin dependence from non-insulin dependent. And among non-insulin dependent, instead of starting multiple drugs, we can wait. And third is young diabetics who are just now detected diabetes in last 4 or 5 years. They can come out of diabetes, called as diabetes reversal or diabetes remission. So entire core is this roadmap. This is the basic point, starting point for evaluation of diabetes. So entire last 30 years, diabetes, the budget is only fasting blood sugar, and that price of fasting blood sugar lab price is same, and they want to interpret entire management only on one test. No, you have to come out of blood sugar, you have to go for other tests, and not the nerve conduction test or EMGs and all unnecessary 40,000-50,000 tests are being pumped on onto the patients, which are no way useful. So one single test which is useful is fasting insulin test. So I kindly join I'm starting a 12-month program for all the doctors from all specialties. You can join me either online or offline, and 600 topics are there. I will be covering them. So come to my website www.homahealthcarecenter.in, or you can come to my YouTube, HOMA Surendra Nehru, or you can come to my WhatsApp group 099637219999. My name is Dr. M. Surendra Nehru, MD Physician. We are joined my Quit India Diabetes and Obesity movement. Thank you.